You've heard the word data many times tonight, and I'm going to talk about a particular pool of data and your contribution to this pool of data that we're looking forward to over the next couple of years. And as we've said, what the impact of that data is going to be on the system and about healthcare, the improvements that you can make for your patients and on the system of healthcare in Ontario. So I'm here to spend a few minutes talking about what's called now the AIMS program. When we met a year and a half ago, or as we've met over the last year or so, we've talked about our quality improvement program, and it now, as you're, I'm sure, aware, has a name, had an official launch in November. It's the Assurance and Improvement in Medication Safety program. So I'm going to talk a bit about why it's a program and the importance and what we're stressing about the program, its importance to you, its importance to the college, and most of all, its importance to your patients. And you can see that the title, the title of the program has been chosen consciously, and I'm going to talk a bit about its evolution as well. So this is about using data that's going to come from you in order to promote patient safety and to improve the system in Ontario for our patients. So a bit about our medication safety journey. You might remember that this commitment to consider improving medication safety began a couple of years ago with the very unfortunate death of a young boy from a pharmacy error in Ontario, and a realization that although there was at least one other province that had a system of requiring mandatory anonymous reporting of errors into a data system, we did not have that in Ontario. We had voluntary, we encouraged reporting of errors. We certainly had an encouraging of quality improvement systematically and in our own places of practice, but we didn't have an official program. It wasn't a mandatory requirement. So when this unfortunate death occurred, the college took it upon ourselves to put together a task force, a working group, and one of the members of the working group was actually the mother of the boy who had passed away. And we felt that this was really important, and the reason I mention it is that she has been really a driving force in the development of the program, and the fact that it has quite an extensive, a broad range of goals, and is not just about the reporting of errors, but is about all of the learning and the data and the accumulation of learning across the spectrum of our practice, both individually in our places and system-wide. So she was very committed to improvement for the healthcare and across the system in Ontario, but quite honestly across Canada as well. So she has achieved something quite dramatic in Ontario, and it is now spreading to all of the provinces, just so you know, all of the colleges of pharmacy across the country. So this task force made certain recommendations, and the result was our quality improvement, quality assurance program, which, yes, included, first of all, mandatory anonymous, and by anonymous we mean anonymous information to the college about the actual individual incidents, to a reporting system, so to a platform, and the embedding of that information within a quality improvement culture in your own place of practice and in all of the things that we do. So as Susan has talked about the big why here right in the middle is that the recording, the understanding, and the learning collectively from all of the medication incidents that have been that will be recognized involving pharmacy for the purpose of reducing the risk of recurrence and creating a better system, a safer pharmacy system, a safer medication system for all of the patients that you will touch in Ontario. So that was the real goal, not just individual learning, but that there would be system-wide improvement. So over the last year, the college has worked on program approval through our council and development of not just the platform and not just the data fields that would be important to the program, but the development of all of the facets of the program going forward, because this is a real commitment for the future of patients in Ontario. We've had an ambassador phase. We didn't call it a pilot phase over the last year. We called it ambassadors, and we're very proud and impressed with the ambassador stores that we had because they contributed in a great way to the data fields and into the platform itself so that because this was a big commitment for the college on your behalf, so that we would know that the platform and the recording would be used into the future in the best way possible. So we had about 100 ambassador stores, followed by a launch in November. and implementation in a staggered way to all the pharmacies in Ontario. So we've done it in tranches, we've done it in groupings that made sense, some corporate groupings across the province, and we're well aware that that we're about 60% of the way through, and well aware that we're constantly making improvements to the program and to the platform, and I'm going to talk about some of those learnings this evening. So the AIMS program is predicated on a safety culture, and I just want to take a second to talk about what a safety culture is. This is not, when we talk about incident reporting, either incidents or incidents that don't reach the patient, so near misses as they're called, we're talking about a recognition that we have to change the culture within our profession. We have to make it safe for all of us to recognize incidents and near misses in order to talk about them. And we have to make it safe for all of us to do that collectively and individually in our places of practice. A just culture or a safety culture, a safe culture, is not something new to the healthcare system. It may be new to us in pharmacy, probably not new to people in hospitals or some other institutions where it's been talked about quite a bit over the years, but other health professions, physicians and nurses are well aware of a safety culture and a need to move towards this view of learning from incidents, and in our case, near misses as well, so that we have this collective learning. So for pharmacy, for us, it's going to be about enabling sharing of lessons learned from the medication incidents through their reporting, collective reporting, the shared accountability, and I'm going to talk about everybody's role in the production of this data that will supply the learning, between the shared accountability between the operators of pharmacies, the designated managers, the pharmacists, anybody in the room, anybody that you practice with is going to have a shared piece of this program going forward. It emphasizes learning and accountability through developing this culture where we are all conscious and all willing to bring forward any of these incidents for our group learning. Anybody in the room would acknowledge that nobody wants to make an error, nobody wants to be involved in an incident or a near miss, and so we all have this collective responsibility to make sure that we are lessening the possibility that they will happen in the future. And it's really important that we have a consistent approach. So any kind of data, good data, relies on consistency of its recognition and of its reporting. So for quality improvement, for real quality improvement, we need a consistent approach. So no shame, no blame, lots of sharing. And I would say also lots of care for the professionals who do reporting and who do make errors and have near misses, incidents and near misses occur around them, because we have to take care of each other in order for this to work. So all of those factors of a safety culture are included in the components of our AIMS program. So first of all, we're talking about reporting. I want to stress again that this is anonymous in the sense that the individual incidents are anonymous to the college, so they are on a platform for aggregate learning. They are specified and they go to an independent third party. So the third party is the provider of the platform that we engaged over the last year, a company that you're probably most of you familiar with by now, Pharmapod, with an international reputation for doing this around the world. That there is documentation of the errors, of the incidents, of the near misses, but also of the plans and also of the outcomes of the learning individually as you recognize them in your particular place of practice. Important that analysis occurs. So as Susan has talked about and as Nancy has touched on, you can have all the data in the world, but if you don't analyze it properly, if you don't do something with it, then we can't learn from it. We can't learn from it individually or in our places of practice, and we can't learn about it as a profession or across the system. And of course, that we share the learning, that we have an open dialogue, and that's really what the program is all about, that we are looking forward over the next years and well into the future of what this is going to teach us, that there's going to be local learning. I'm going to talk a bit about what your own dashboard is going to look like and how exciting really it will be that you will have some control. You will be able to do things within your own power in the future to make it a safer healthcare system and to make your place of practice a safer place. And so again, these four pillars of the program are all critically important, no one more than the other, but they all have to work together. And that's really what the task force was interested in, that it all work together into the future to make everything safer. So once you onboard and record incidents and near misses, the question to all of you is that all you have to do? Is that the end of it? And I'm sure that you have gotten the message by now through the presentation that it's not just about recording the incident or near miss, it's what you actually do with the information that is where the true benefit lies. And I'm sure that you already know that. I'm sure that you have taken steps over your careers or in your places of practice over time to do this. But now we have a system, and now we have a consistent way of doing it so that we will have the shared learning. So the foundation is the recording of the data and the recording of the incidents and near misses, but what we learn from it is the important piece. So I'm going to talk a bit about shared accountability. And what I really want to stress here is that you can have lots of people working in your dispensary and lots of people working in your pharmacy with different roles, and every one of them can have a job to do, can have a role in making sure that this works. It can be a small role, it can be a large role, but it's really important that everybody recognize that you're all a piece of this working. So the shared accountability, I'm going to talk about, first of all, what owners and designated managers and the staff can do. So that's obviously all of you. You have a responsibility to recognize and to record the incidents and near misses. You have a responsibility to take those prompt measures, and that's what we've all always wanted to do as health professionals. We've wanted to recognize what it is we can do personally to prevent them from happening again. To analyze and to implement improvements. So some things are very simple, some things we will all recognize. We hear anecdotally sometimes about errors and near misses, and we think, oh, that's good that I hear about it because I could prevent something or change something. But the point is you have to do it promptly and you have to do it consistently. You have an accountability to use the tools and resources that will be provided, that we're all learning about from the college and that will be at your hands in order to make these improvements. And as I've said, we have to make sure that we nurture this safe culture. So everywhere that we practice, it will be consistently safe for everyone to recognize when these occur and to document and take those next steps. So, you know, sometimes there will be some discomfort. It's not always easy to address someone who has had an incident or a near miss. And maybe it's not always easy for someone to bring it to your own attention, but this is our shared accountability that going forward, we're all going to make this commitment and we're going to do this consistently. So for the college, and as Nancy and Susan have demonstrated, we have an equal role as the regulator in helping all of you succeed in improving patient safety and improving the system of medication delivery in the province. So our role is to support education, to support the onboarding. So by onboarding, I mean the initial use of the platform, of the Pharmapod system, and to make sure that everything is working well enough. And that's where those ambassador stores and any of the stores that are currently working on the platform are helping us to understand how to make it better and how to improve things so that it's second nature for this to occur. Well aware that everybody is very busy and that there are lots of things that need to occur in your pharmacy or place of practice. We will be analyzing, lots of analysis to come. So what you're hearing tonight is that data and information is one thing, the analysis and the use of the data is the thing that we can all use to improve. So again, de-identified, so information that is not specific or particular to a place or to a person, but is able to be used and analyzed for all of the learning. So it's aggregate data, de-identified. We will have the responsibility for developing recommendations and guidance. So obviously, you have a little window in your place of practice, but we will have a big picture, and we will have a responsibility provincially and soon nationally as all of the provinces roll into some kind of program to recognize, because pharmacy practice can't be that different from place to place. So it's really important that we have the opportunity. You know, sometimes we practice in a bit of isolation, maybe not in Toronto, but there are places where we practice individually and we don't have the exposure to each other's incidents and near misses. So this will be really important that we all benefit from the sharing and from the data. So we, the college, will be sharing broadly within the system and publicly. So this is a bit of a scary thought. We will be sharing publicly what we have learned, what the reporting has been, and what we have learned. So that's a bit about accountability, but also about transparency. So we will be letting people know the kinds of things that occur and the improvements that are being made so that people will have trust in you, in us, in pharmacy, in the system, and quite frankly, in the regulator as well. So we are listening, and this is part of our process as we've been onboarding and as we've been getting people to use the platform. We are listening. As we've been onboarding, we've been listening to people's usage of the platform. We've been listening to having technical assistance. We've been hoping to improve things so that it's well aligned with your work plans. And we've been as well streamlining processes and recording. So we're well aware that this is sometimes considered another thing that you have to do on top of all of the steps that you're taking in your place of practice, in your pharmacy. We're looking to streamline things. We're looking to make it easier for you to do the right thing so that we can all do the right thing. No intent here to make things harder. The intent is to make things better, the big why. Utilization of the platform and use of resources. So we're listening to how that's working. We're listening, and we will be listening continually as we roll out new parts of the program. So the things that we consider to be important will need to be important to you too, and they will need to work well. And finally, just a word about near misses. When I say that we're listening, we've heard from other provinces that have rolled out programs like this, that sometimes the definition of a near miss is a bit of a struggle for people. It's a struggle for a team. There might even be some disagreement as to what a near miss is and whether that particular near miss actually has to be recorded into the system. So I just wanted to mention that we have published a definition of near misses. We're aware that sometimes it's a bit of discussion that needs to happen in a place of practice. The importance is that you're consistent and that you think about it and that you're mindful of the reason for the recording and the usefulness that will come from whatever the near miss is. So it's not so much that you have to have it so cut and dried all the time, but you have to discuss it and you have to consider it within your team. What would be useful for that big why that we've talked about? So finally, just a word about what a dashboard might look like. So when we talk about data, what will it actually look like when we start reporting? The intent here is not that you read the numbers, because I recognize it'll be very difficult for you to see any of those numbers, but the importance is that you will have a dashboard like this in your particular place of practice or pharmacy. So you're going to have a window, you're going to have a view of when these things occur, why they occur, what led up to the incident or near miss, so that you can start doing things right away. Because wouldn't it be exciting, wouldn't it be motivating if you could actually identify, for example, what time of day, what shift, what day of the week, what kind of drug, what led up to some of the incidents. Because if you had that picture, then you could more quickly get your team together and talk about what the improvements would be. So in some ways, it's a bit scary that this will be all visible and all be very transparent, but the beauty and the strength of it is that you will have a dashboard. We are going to have aggregate data, so we will have data that we analyze, obviously from a large group, but you will have the individual ability to look at your own dashboard and see what it is that you can do to change things. There's information here about harm level, so you will be recording things about whether it's severe harm, whether it's minor harm, all things that will be important to you to improve the practice in your pharmacy. And it might look a bit scary that these will be things that will be open, will be transparent, and will be visible to people, but we can't change what we don't understand, and we can't change what we're not able to analyze. So these are just some examples of the different slices of the data that you will see and that we will be able to use. There will be a response team, so we've put together a group of professionals who will be able to analyze the data for us. We'll be able to look at what has been produced, what you have produced and recorded, and able to make the recommendations that you will need and that we will need across the province. So important that you know that you can see your data on an individual basis. We will not see it for your particular store. So where are we now? But just a bit of a summary. About 60% of community pharmacies are now onboarded. As I said, we've done them in groups. All pharmacies will be onboarded by mid-2019, and now that summer's almost upon us, that's getting closer, and that's a very happy number for us, so that's soon. As I said, there will be an initial public report that we expect to be published sometime in June, so probably in latest June, summer here we're saying, by a response team. So a response team made up of academics and users and people that will be trusted with doing some of this analysis. And the point being, as you've heard tonight, that we can now turn data into information and learning. So no more will it be sort of anecdotal information about what happens in pharmacies. It will be actual data that we can use to make recommendations and for all of us to learn from. Just a quick mention about hospital pharmacies. We will be leveraging the existing and well-established processes in hospitals. It's not that we're ignoring hospital or any other places where pharmacists practice or where there is drug distribution, but we knew that there was a gap in community pharmacy. So we knew that there was a gap in the consistency of reporting and of data coming from community. So that's where we're addressing things first. That's where we're putting the program in place. And we are working on a plan this year to get into hospitals next year and going forward. Just one last word about another piece of the program, which is really important. The PSSA, so many of you will already have done some sort of a self-assessment. So this is a pharmacy self-assessment in your pharmacies. I'm happy to see some people nodding because it was always an encouragement by the college that you do a PSSA, that you do a self-assessment, because for any of us, how can we improve or learn unless we do some kind of assessment of what we're doing in the currently. So there will be a formal PSSA component to this program, and it will be important, and it will be a commitment of all pharmacies in Ontario that you do a self-assessment within the first year after onboarding onto the platform, and that you do a self-assessment every 2 to 3 years. 2 to 3 years, you might wonder why. Well, that's because any kind of self-assessment, you have to do it first, find out where the gaps are, and then put a plan in place to address them. So it's a process of continuing improvement where you have a chance to make the improvements before you do the next self-assessment.